Good morning. My name is Joe Ruffolo. I'm the President and Chief Executive Officer of Niagara Falls Memorial Medical Center, here to give you our COVID-19 update. More importantly, the message today is don't delay treatment for medical emergent issues. Don't delay treatment for medical emergent issues. And I'll get into a little more of that. But first, with respect to a COVID update, so as you know, there's still a very significant lack of testing that exists in Niagara County. The only ones that are really getting tested are patients that present to the ED that have COVID-like symptoms, or healthcare workers that are expressing similar symptoms. So altogether, we have tested approximately 85 individuals since we've started. About 22 have been tested positive. So roughly 25% of the people that presented themselves that were COVID symptomatic did in fact have the virus. So of the 22 positives, the good news is that 14 have been discharged and released and are recovering at home or have fully recovered. And we currently have 7 in-house that are in isolation in a segregated area being well cared for. So the message is it's safe to come to the hospital if you have medical emergent issues. You should not delay treatment. So for example, for people that are experiencing chest pain, for individuals that are suffering from chronic disease, such as congestive heart failure, or COPD. Individuals that have been delaying surgery or postponing your visit to the surgeon's office because you have appendicitis issues or gallbladder issues. You know, we're seeing patients now presenting to the emergency room that have pushed off their abdominal pain relating to appendix. And quite frankly, the longer you wait or prolong that, the higher risk for infection to set in. And what could be a very simple outpatient surgical procedure ends up being a very high-risk inpatient procedure, which is not good for the patient, and it makes it a very challenging surgical procedure for the surgeon. So the message is please do not delay treatment for medical emergent situations. Just to further make that point, the further that individuals delay for receiving treatment for dealing with their chronic issues, the mortality rate among delaying treatment could ultimately be greater, much greater, than the mortality rate from the COVID virus itself. So again, it's a very safe environment. If you're having ongoing issues with some of the ailments that I discussed and others, don't hesitate to come to the emergency room, or don't hesitate to come and call your doctor or your surgeon so that you can in fact be treated. Because there are individuals out there that are still having heart attacks, and there are still many, many individuals out there that are very much challenged with the chronic condition. So please seek the assistance of your particular medical profession for the help that's needed. Again, just to reemphasize, the environment in the hospital is safe. All of the employees are wearing the proper PPE gear. The COVID patients are treated in an isolated area within the guidelines of the CDC and the New York State Department of Health. Again, the good news is 14 have recovered nicely and been discharged either from the emergency room and not needing hospitalization, or they needed hospitalization and were discharged home. So with that, stay healthy. Again, don't delay treatment for medical emergent conditions. call your doctor or come to the emergency room if those issues persist, so it doesn't make what could be a very simple procedure very much complicated with the risk of infection or septic setting in. Thank you very much.